Medical laboratory technology and professionals, we often work behind the scenes, so people don't know that we exist and they don't know that we're there. And even though I had some idea, I even said, I wish somebody had told me about this right after high school. But yeah, I did find my way here and I love it. I'm absolutely passionate about it. My name is Rachel, and I am a medical laboratory technologist. When I was very little, I wanted to be an artist. I also wanted to be a waitress and a singer. I always had a bit of an interest in science. I was the kind of kid who always liked to learn things. My mom, when I was a child, got me the big book of why because she got tired of not being able to answer my questions. So I was always sort of interested in science, but where I really, really fell in love with it was about grade 9 or 10, and I started taking a specific biology class, and I fell in love with biology. Biology was the big one. So I was actually an all-around pretty good student. I really enjoyed learning. I enjoyed a lot of the schoolwork. I enjoyed getting good marks. So I did tend to do well. What I enjoyed the most and therefore excelled at a little bit more was science and math. Kind of an introvert, so I didn't really want to do a lot of extracurricular stuff, but I did have hobbies: reading, writing, drawing. Back then, the internet wasn't quite as amazing as it is now, but I'm sure I would have watched a ton of science stuff if I'd had the opportunity. I was never ashamed of being a geek, ever. My path was a little bit roundabout. As I said, I tended to do really well in school, and I fell in love with biology, so I thought, I'll get a biology degree. Unfortunately, I was one of those students who did well in school without trying. When I got to university, everybody said, it'll be different. I said, I know. I did not know. The pace was so very different. It was a lot faster, and I'd walk into class and go, I don't know what's happening. So then I wound up working for a while in customer service, which, by the way, gives you great skills for helping with patients. And somebody recommended this to me. I can't even remember who it was, but they said, you should look into this. You like science. I know that medicine interests you. So I looked into it and went, okay, and I applied. And it was very interesting because I had some idea of what they did, but not a total idea. And even though my path was kind of curvy, I can't think of a job that suits me better. It is that I wound up exactly where I should be. What MedLab is all about is providing answers to doctors from patient specimens, getting results from those specimens that will help doctors diagnose and choose the right treatment options for a patient. For being a medical lab technologist, actually go to NBCC right now, and this was how the program was when I went as well. It's a diploma program, and it's 2.5 years. So we do 2 years in the classroom, and then you do a term out in the hospital where you're actually out there working with lab techs who are helping train you and hone those skills so you get that experience before you go out and actually start working. So for medical laboratory technology, we cover a lot of things that people don't think of, like professionalism, communication. Communication is so key to what we do. Most patients that report a negative experience in the Medicare system, it's communication that was the problem. So we teach you a little bit about communication and how that works and how to communicate with a patient. We teach you how to draw blood, which surprises most students. It surprised me when I started. I didn't know I walked in my first day and they said, you have to learn how to do 100 blood draws. And I went, I have to do what now? Not everyone winds up working doing that, but you do have to learn how. A typical day for a med lab technologist does vary depending on where you work. If you're working in a large hospital lab, there's a bunch of different departments. So if you're in chemistry or hematology, you're going to be working with a lot of instruments that help you get those analyses. Great big machines that you put a specimen on that helps you get those numbers. Personally, I worked overnights by myself in a hospital in the lab. So sometimes my nights were very, very hectic, but I managed a lot of maintenance. I managed all the machines on my own. I went and drew blood from patients, which was really fascinating because in a small hospital, you go see the patient, you draw the blood, you come back, you bring it to the lab, you test it, you see them right through to the end. So all kinds of testing and getting results to doctors. Lots of telephone calls. It's really hard to pin down because I love everything about MedLab. For me, when I worked overnights, honestly, one of my favorite things, one of the reasons I wanted to do it was I worked on my own, so the lab was mine. I got to do things my way, and I got to see the patients and see the whole carry through and do everything. And troubleshooting, finding when there's an error or how to fix it was all up to me, and I enjoyed that problem solving aspect. And at the end of the day, no matter what happens, you know that you helped people, whether you helped save their lives or just helped them get better faster, helped the doctor treat them better. You knew you helped people. You don't have to be introverted to be a good fit for med lab. A lot of people tend to be, but you don't have to be. But good attention to detail. You need to have really strong attention to detail. You need to have passion for the job. Good problem-solving skills and critical thinking skills are really essential. So being able to come across a problem and think, how am I going to fix this in a way that is going to benefit my patient? So the advice I would give is first, do some research. Because you want to find out what area of medicine might appeal to you the most. People tend to think of healthcare professionals and they think doctors and nurses. But there's so many different professions like med lab or respiratory therapy or personal support workers, or there's all kinds, pharmacy. So see what appeals to you. Really honestly reflect and look at your strengths and weaknesses and what you're willing to do to get there. A lot of people don't realize that med lab involves a lot of math and chemistry, so that tends to throw them off when they get there. I'm not saying if you struggle with math and chemistry, you can't do it, but if it appeals to you and you know you struggle, start putting the work in now to get those study habits in place and to start learning it and to find ways to make it a little easier on you. A lot of people, when they learn about us, think the only place you could ever work is in a hospital lab. That is where most of us work. It's not the only option. A lot of people they do the med lab training, they work in the hospital for a while, and they find it's not for them. I have a former colleague who works with one of the manufacturers of the reagents we use in the lab. So she works doing a lot of the testing to make sure it's working on that end. You have some people go into sales for the big instruments and all the chemicals that we use. So there's a whole bunch of different options, actually, where you wouldn't think of it. Agriculture is another one. MLT, I have a couple of classmates that worked in agriculture for a while. The testing is almost exactly the same. It's just different stuff you're looking for. I have to say, I love teaching. I always wanted to teach. When I fell in love with biology, the only thing I could think of that would satisfy me would be to teach it all day long. So I eventually wound up here. I do really miss the labs, though. If I had all the energy in the world, I'd go back and do that too. I love when students tell me that my passion for the job makes them feel passionate about it. So that's a big thing. And when I was in the lab and I did overnights by myself, sometimes it'd be very busy. You'd have a lot of very, very sick patients. And some nights you would go through everything and you would do so much and it would go so well that you walked out in the morning and you felt like a superhero. And that was just a rush that can't compare. Obviously, my family, my parents always really encouraged my interests and my ability in school. Like I said, my mom got me the Big Book of Why. It wasn't just because she was tired of not being able to answer the question. She also wanted the question to be answered. My dad was always good in school too, so he always kind of liked that. I had a biology teacher in high school that was probably the only teacher I had that would have even remotely prepared me for post-secondary. She was a little stricter than most, but she was very intelligent and she saw my passion for biology. That was Ms. Garland at St. John High. She had a big impact on me. After that, I had really, really great instructors. All of my instructors were great. I love them all, but there was one that I really connected with. Her name is Margie, and I actually work with her now, which is amazing. I found I could really talk to her, so we talked a lot about stuff when when class was over and things like that, and it really had a big, big impact on me. University really is different. You need to learn study habits. You don't have them, you need to learn them. They will help you a lot. After I messed up university and came into lab school, I learned study habits and it made such a difference. That and what I'm gonna say to a lot of people here today is university isn't the only path. There's still a stigma that says like community college is not for the smart kids. that's not true. It's just a different kind of training. University is very, very knowledge and theory based, whereas a lot of stuff in community college is teaching you technical skills so you can go out and get a job. They're just different. And you can find a lot of things that you really enjoy in either one. So it really depends on what you want and what you're looking for and where your skills lie. To know that early on could really help. Professionally, I absolutely love my job. Anytime a student tells me that I've really helped them understand something or that my passion for the work has ignited their passion for the work, just thrills me right to death. Personally, I'm still a geek. I still like all the geeky things. I have a partner and 3 cats at home. We love animals. Playing video games, reading, very twisted sense of humor, so I won't get too much into that. But that brings me a lot of joy. For a while, I worked on PEI and then in Moncton, but all my family is here, so I'm home now, and I really like that too, which is another great thing about MedLab. There's jobs across the country, which means you can work pretty much anywhere. If you want to work home, you might have to wait a little bit to get back there, but you'll be able to find a job home. If you want to go travel, you can travel. I was born in St. John. I was raised in St. John. All my family's from St. John. And we really do have a beautiful province that often gets overlooked. And that's just a shame. And I always wanted to stay here and help be part of what made New Brunswick better.